Bulubilaka. Today, the Ministry of Health and Medical Services is announcing 2 new border quarantine cases of COVID-19. Both are Fijian citizens who were repatriated from India on the 1st of July. One is a 37-year-old son of our first border quarantine case that was announced yesterday, and the second is a 36-year-old female. Like the other 2 cases, she had been in Chennai, India, where she accompanied her husband who was undergoing treatment for some medical condition. The border quarantine case 2, who's a 37-year-old male, currently has mild symptoms. He's the same one that we were speaking about yesterday, the son of our first case. And together with his father, they have been transferred from Nandi facility to Lautoka facility. The reason they've been transferred to the Lautoka hospital is only because the dad has some pre-existing conditions, a medical condition, and he's of an advanced age. So this is mostly a precautionary measure. Our border quarantine case 3, the 36-year-old female, she's also reported mild symptoms of COVID-19 while in the quarantine facility. Her test was positive this morning in the Fiji CDC. She is in a stable condition and has been transferred along with her husband to our Nandi isolation facility. Her husband will be tested today, and tomorrow we should be getting some results. All the rest of our 105 patients will also be tested tomorrow, and by the end of business tomorrow we should be getting some results. All of the people that were on the plane have been in our quarantine facilities, and they are currently being supervised in the government-funded quarantine facilities. I want to be very clear over here. Not a single passenger on board that flight from India is among the public. Every passenger was safely transported to the quarantine facility the moment they arrived, where they have remained under strict RFMF supervised, supported supervision. Every passenger has only engaged with medical staff who are wearing proper PPE or protective equipment. The flight crew that flew with them are no longer in the country. Today marks 80 days since our last case outside of a border quarantine facility was reported. As highlighted yesterday, the cases of COVID-19 are accelerating worldwide, including in India. We have never closed our borders to our own citizens during this pandemic, and have been receiving repatriating citizens who have undergone mandatory 14-day quarantine in the government-designated and supervised quarantine sites since the 28th of March. Since April 23rd, all passengers in the quarantine facilities have been tested for COVID-19 before we release them out into the community, even though they have no symptoms. More than 3,000 Fijians have safely come home through this process without leading to infection to a single person in Fiji. Fiji's defenses against COVID-19 have been tried and tested with the first 18 cases and now with our border quarantine cases. What we have shown, and we need to continue to demonstrate, is that we have systems and processes in place to continue to contain COVID-19 and prevent the spread into our communities. We have seen breaches in other countries with similar border quarantine systems. We have not noted the lessons that we have learned from them, and we've incorporated these lessons into our own protocols. Like other countries that have been successful in containing COVID-19, as long as we continue to welcome back our own citizens from nations with large-scale outbreaks, we will continue to find cases at our border. This is a new normal, because we cannot turn our back to our own citizens, not to our people. We must not lose sight of our humanity, even in difficult times. Most importantly, our healthcare system, supported by our disciplined forces, is proving to be able to manage these cases without risking infection to the community. I will re-emphasize again over here, as long as our border quarantine protocols are upheld, there is no risk to the public of Fiji from these latest border quarantine cases. Thank you.